Do you have unusual tiredness, easy fatigue, breathlessness during rest or exertion, or if you have signs of fluid retention such as swelling of the ankles and feet, then it's time to have yourself checked because these are possible signs and symptoms of heart failure. Hi, I'm Dr. Alan S. Tenerife. I'm an internist and adult cardiologist. An adult cardiologist is a medical specialist who manages adults with diseases of the heart and blood vessels. First, it's important to know the function of the heart. The heart is a hollow muscular organ that pumps blood to supply oxygen and nutrients to the body's tissues and organs. There are two types of heart failure. The first kind of heart failure is systolic heart failure. In systolic heart failure, certain medical conditions can cause weakening of the heart muscle, causing the pumping mechanism of the heart to fail. The second type of heart failure is diastolic heart failure, which is caused by conditions that render the heart thick, stiff, and non-compliant so that there is a problem with filling of the chambers with blood. Certain medical conditions can lead to heart failure. Some of the most common ones would include uncontrolled hypertension, coronary artery disease, which is a blockage of the arteries supplying the heart, especially if coronary artery disease would cause a myocardial infarction or heart attack, which damages the heart muscle, causing its pumping mechanism to fail. Other causes of heart failure would include certain muscular diseases called cardiomyopathies, which may be caused by a previous viral infection. Or sometimes if the cause of a cardiomyopathy is unknown, it's labeled as idiopathic cardiomyopathy. Also, the use of illicit drugs and prolonged exposure to high doses of chemotherapeutic agents could also lead to heart failure. The symptoms of heart failure would include tiredness, weakness, easy fatigability. Sometimes the patients may become breathless during exertion or even at rest, so that they have difficulty in performing the everyday tasks they were easily able to do. Fluid retention, which could be seen by edema or swelling of the legs, the ankles, and the abdomen. Some of these patients cannot lie flat in bed at night and have to be propped on several pillows. This is known as orthopnea. Or sometimes during night, the patient would wake up, suddenly become breathless for air, and this is called as paroxysmal nocturnal dyspnea. If you have a rapid weight gain over the past few days, then it's time to see a doctor. The diagnosis of heart failure should begin with a good history taking and physical examination. The physician would be able to diagnose or have the idea that this patient is having heart failure. However, one very important diagnostic modality that is used to confirm the diagnosis of heart failure is a 2D echocardiogram, also known as a 2D echo. A 2D echo or a cardiac ultrasound uses high-frequency sound waves to create moving images of the heart in real time. This 2D echo would be able to check the structure and function of the heart. A 2D echo is very important in the confirmation of diagnosis of heart failure because a 2D echo will show the heart structure and function. We would be able to see if the heart is pumping adequately. We could check the heart's ejection fraction, which is a measure of the heart's pumping ability. If there's also diastolic dysfunction or stiffness of the heart, which makes it harder to pump blood, this would also be seen in a 2D echo. A 2D echo is very important because it's non-invasive, it's affordable, and also follow up the effect of treatment on a particular patient with heart failure. To improve a patient's quality of life, first, if the patient is smoking or drinking, we have to advise the patient to stop smoking or drinking. It's important for the patients to take their medicines for high blood pressure or diabetes. They have to take them regularly. They also have to cut down on their water intake because too much water and too much salt would also lead to fluid retention and increase in symptoms. If the patient is obese, it's very important to cut down in weight because the additional weight would also impose burden on the heart. So heart failure is a preventable condition. If you have high blood pressure, if you have diabetes or other medical conditions, you have to see a doctor and have these medical conditions managed. And if you have symptoms that may point towards possible heart failure, it's very important to have yourself checked, because the earlier the condition is diagnosed, the earlier treatment could be instituted, and this would lead to a better prognosis to a patient. A 2D echo in the doctor's hospital would be very helpful because it is a non-invasive test that would confirm the diagnosis of heart failure and would guide the doctor in deciding on what particular treatment regimen should be started on a patient. So we know that heart failure is a progressive disease, but with early diagnosis and treatment, especially diagnosis with a 2D echo, the doctor could start medications that would improve quality of life and even prolong life of a particular patient.